I'd now like to very quickly introduce our very busy next speaker. Senator Chris Van Hollen from Maryland has been deeply involved in a range of healthcare issues: affordable prescription drugs, better primary care, greater access to effective care. Senator Van Hollen is also part of the leadership on this effort to address hepatitis C elimination. Thank you for joining us today, Senator.
Well, thank you. Thank you, Dr. McClellan. And it's good to see you, even if it has to be virtually after this time. Look forward to reconnecting in person at some point soon. And really thank you and the Margolis Center for all the work that you're doing. And I remember well the times you and I spent together when you were over at FDA and the Centers for Medicare and Medicaid Services. Proud to say both of them are the great state of Maryland. And to all of you joining this important conference, thank you, scientists, educators, policy experts at the Margolis Center and beyond. I think you know well, this is the purpose of the conference. We're at a very exciting time in our longstanding battle against hepatitis C. We all recognize that it's one of the most common lethal infections in the United States and causes daily harm to Americans from all walks of life, claiming over 15,000 lives each year, affecting over 2.4 million Americans. And the cases have doubled in the last decade, the reported cases, and we know that it is likely very more because of limited testing capabilities and resources to prevent and cure this disease, meaning there are likely a lot more suffering who are unknown to us. So for these reasons and many more, defeating Hep C is a priority for many of us here in the Congress. And the good news, as you all know and have been talking about, is we can do that. We can defeat Hep C. I was very pleased that President Biden in the fiscal year 2024 budget proposal included resources for these purposes and shared the commitment to identifying and curing this disease through the goals outlined in his National Hepatitis C Elimination program. And I am working on a bipartisan basis with colleagues in Congress to accomplish that. Senator Bill Cassidy and I have been in regular communication and hope to have something ready to introduce soon. And of course, our guiding light here has been Dr. Francis Collins. I want to give him a big shout out and thank you for his commitment and perseverance on this really important health matter. At the center of our plan is the subscription model to obtain and distribute the cure at a bulk price. As you all know, having drugs on hand is not enough alone, however, so we build out the public health infrastructure through primary care, community health centers, opioid treatment programs, and correctional facilities to test, treat, and coordinate care for patients. The proposal would also increase the Hep C surveillance and outbreak detection to inform and improve our response. With this plan and the investment, we have an opportunity to save 24,000 lives over the next 5 years and also save $8 billion over the next 10 years. And Mark, as you and others know, showing CBO, the Congressional Budget Office, that we can realize those savings, I think will be very important as we move through the legislative process. And I think all the analyses I've seen shows that is a very real possibility and very likely. This, of course, if we pass this, would be a milestone for those battling Hep C. It would also, in the end, be a net plus for the American taxpayer. I should mention that another component of our Hep C response is the rapid point of care testing so that a patient can get diagnosed and prescribed their treatment in the very same visit. And there's a point of care RNA test being used in Europe and hopefully the FDA, where Dr. McClellan used to lead, can validate its effectiveness for use in the United States. So I know all of you at the center are working on a framework that aligns with this model to bolster our fight against Hep C. And I do look forward to continuing to work with you and partner with you as we try to move this over the finish line. I will say, as a member of the Senate Appropriations Committee, as we move forward on this initiative, I'm also committed to securing the necessary funding so agencies like the CDC and the NIH have the resources they need to prevent viral infections like Hep C. So let me just, in closing, thank all of you at the Duke-Margolis Center for Health Policy. Dr. McClellan, thank you and your team there. And I do have a vote on here in the United States Senate, but I just wanted you to know, and I appreciate your letting me zoom in here. I wanted you to know that we are focused on this in the United States Senate. The challenge, as with so much else these days, is for us to identify what legislative vehicle we can put this on once we have a final product. We're still trying to finalize the details, but I really hope that we can do that within just a few weeks. And then hopefully we can look to early next year to find something that we could put this legislation on so that we can expedite its passage, get it to the president's desk for signature. To do that, we look to all of you for your continued support and input. Many thanks to all of you for being, key members of the team in achieving this very important healthcare result for Americans, and indeed for as a model for others around the world. So thank you all.
Thank you. Sir Van Hollen, thanks so much for joining